Symptoms, causes, and prevention of cervical cancer. 1. Symptoms. Early-stage cervical cancer often has no obvious symptoms, so regular screening is important. As the disease progresses, symptoms may include abnormal vaginal bleeding, bleeding between periods after menopause or after sex, abnormal vaginal discharge, discharge that has a foul odor or unusual color, pink, brown, or mixed with blood, pain, pelvic pain or pain during sex, late symptoms, advanced stage, swollen legs, difficulty urinating, back pain, or persistent fatigue. Note, these symptoms may have other causes, but if they persist or are unusual, you should see a gynecologist immediately. 2. Causes. The main causes and risk factors of cervical cancer include human papillomavirus, HPV. HPV, especially types 16 and 18, is the main cause, causes more than 90% of cervical cancers. The virus is transmitted sexually, including through skin-to-skin contact in the genital area. Other risk factors: early sexual intercourse or with multiple partners. Smoking increases the risk of cervical cell damage. Weak immune system due to HIV/AIDS or immunosuppressive drugs. Long-term use of oral contraceptives, 5 years. Having many children, 3 times, or having children early. Infection with other sexually transmitted diseases, such as chlamydia. 3. Prevention. To reduce the risk of cervical cancer, you can apply the following measures. 1. HPV vaccination. HPV vaccines, such as Gardasil, Cervarix, protect against high-risk HPV types. Recommended for children 9 to 15 years old, before sexual intercourse, and women up to 45 years old. Highly effective if vaccinated early. 2. Regular screening. Pap smear detects abnormal cells, performed every 3 years for women 21 to 65 years old. HPV test checks for HPV virus, often combined with pap smear in women over 30 years old, every 5 years if the results are normal. Screening helps detect and treat precancerous lesions early. 3. Safe sex. Use condoms to reduce the risk of HPV infection and sexually transmitted diseases. Limit the number of sexual partners. 4. Quit smoking. Smoking increases the risk of cervical cancer. Quitting smoking helps reduce the risk and improve overall health. 5. Healthy lifestyle. Eat a balanced diet rich in fruits and vegetables to strengthen the immune system. Exercise regularly. Maintain a reasonable weight. 6. Regular gynecological examinations. Monitor reproductive health to detect early abnormalities in the cervix. Note: early detection. Regular screening is the most effective way to detect and treat cervical cancer in the early stages when the cure rate is high, over 90% in the early stages. Medical advice. If you are at high risk, such as a history of HPV infection, smoking, or unusual symptoms, consult a gynecologist. Thank you for watching the video. Wish you and your family good health and happiness.